Hi guys, this is Nurse Eva again, and for today's video, let's talk about an interesting topic that some of my fellow nurses asked me last year when I just started my new job. How did I become an anesthetic nurse even if I did not have any experience in this area? Well, it was a long story, but to make it short, let me just kick off this video with these words of advice. Do not be afraid to go out from your comfort zone. I know that it's difficult because we all have fears of the unknown and life is full of uncertainties, but we will never know, guys, what we are capable of doing if we won't try. So we have to take risks in order to grow, and at the end, it will be all worth it. Alright guys, so let's start. How did I become an anesthetic nurse? First, I started as a general nurse in the Philippines, and after 2 years at the age of 23, I decided to work abroad in Saudi Arabia, and I was very lucky because I was given a chance to be trained in an intensive care unit. So I became an intensive care unit nurse, and I think that was the best experience in my nursing career. It's amazing and feels so good to be able to look after critically ill patients in the most vulnerable stage in their lives, and being part of that care, it's just so rewarding. But after 4 years, I decided to go back home and then pursued my application here in Ireland because my husband lives here. So I started working in a teaching hospital, so it's a public hospital in Ireland, and I was working in a cardiothoracic unit, so most of our patients had lung and heart surgeries. So during my interview for this job, I was expecting that I'm gonna be in a high dependency unit because the qualifications were really high that time. So they were looking for an ICU experience and also a more than 150 bed capacity hospital. So when I got the job, it was very quick and I was grateful. But then after nearly 2 years of working in the hospital and doing bedside care nursing, I was sick. So I had a very bad skin problems, and we couldn't even figure out what's the cause of it. But I can only think the stress probably what I've been through, especially during the pandemic. But anyway guys, let's move on to the reason why I became an anesthetic nurse. So I was looking for a new role. I was looking for a different field of nursing where I don't have to do night shifts anymore. And to be honest, when I was a student, when I was exposed in theater department or operating room department, I never liked the schedule. Okay, and I just felt that I think this area won't really suit me. So when I started practicing, I was never interested in this area. But when I saw the post about Anesthetic and Recovery Room staff nurse, I was curious. So I sent an email to the hospital that I never had a background of this area, but I had an intensive care unit experience. And the person that I talked to said, submit your CV and I will schedule you for an interview. So, preparing for an interview. If you're looking for a job, it is very important that you should prepare for the interview. Of course, you have to do your research about the post that you're applying for. And since I'm applying for the anesthetic and recovery rooms, and I told them that I had a background of intensive care unit, so I was thinking that maybe they will ask questions related from a previous experience, which it really happened. It was a virtual interview, guys. And to be honest, I was interviewed by 2 people. The questions were not easy. And I was just very lucky because I really prepared for the interview. So I refreshed my knowledge and skills about intensive care unit because that's the experience that I presented in my CV or resume, and even my cardiothoracic unit experience. So they asked questions about my current experience, like in cardiothoracic units, so what type of patients that I dealt with. I told them that it's heart or lung surgeries patients, and some of them are connected to a cardiac monitor or telemetry beds, so they're still not stable. And they also asked my experience in ICU when I was in Saudi Arabia. So what's the daily routine? Questions that I won't forget. But I really studied about it, so I was just lucky. So they asked me what are the equipments needed for intubation. And thanks God I was able to answer the question. And they also asked me what are the criteria for extubation. What you're gonna do if the patient is desaturating after extubation. So those type of questions, imagine if you would be asked those type of questions and you're not ready. So it would be very tough and you can't even answer. So just a tip of advice, guys, if you look for a job and if you really want to make it, so you have to prepare for it. Okay, and at least that will ease the pressure because you're ready. When I got a job, so they told me that they're gonna offer an anesthetic and recovery course, so which is an advantage for me because I never had a background of anesthetic and recovery. Because in the Philippines, I remember that there's a recovery room nurse or post-anesthetic care unit nurse, but I never heard a role like anesthetic nurse. We have anesthesiologists, and here in Ireland we call them anesthetists, but I never saw an anesthetic nurse in the Philippines. But in America, they call them nurse anesthetists, and even in the UK. But that's a different role, so it's more advanced and you need to have a postgraduate diploma for that. So during my first day in theater department in anesthesia and recovery, I was just surprised because it involves more skills and knowledge. So I was exposed in an anesthetic room. So during induction, like you're gonna assist the anesthetist for the intubation, and it depends on the type of surgery. So what's gonna be your setup like? So if it's a heart surgery, so it's gonna be a lot of setup. So you need to prepare your intubation trolley and all the equipment needed for intubation. And you need your anesthetic machine for the anesthetic gases. And you also need a central line setup. And you need an arterial line setup, urinary catheterization setup, and you need an ultrasound, you need an echocardiogram. So that's all the preparation. And aside from that, you also need the medications. So there's loads of infusion. And it reminds me when I was in Saudi Arabia as an ICU nurse. So we also have this infusion, like inotropes infusion. So for cardiac surgery, we also prepare it. So I was amazed, and I just said to myself, wow, I love this job. I love this new area. So it was very exciting. And then when I started the course, they introduced us to anesthesia and recovery. And then we did some case presentation. And then I got my certificate. And I started working on my own as an anesthetic nurse and recovery room nurse. It's amazing, guys. So I started my job in June, and it's near a year now. And so far, I'm loving this job. And the roster as well, it's good for me because I don't have to do night shifts. And the turnover is very quick, guys. Alright guys, so that's my story of how I became an anesthetic nurse. So imagine I never had experience in this area. So if I was able to do it, definitely you'll be able to do it as well. So if you want to explore different areas in nursing, do not be afraid, guys, to go out from your comfort zone. Alright guys, so that's all for today, and I'll see you in my next vlog. Bye, and keep safe, everyone.